In this video, let's discuss about anemia. So anemia is a very common diagnosis that we see in clinical practice as a hematologist. So that is one of probably the most common consultation we see in the clinic setting. So people come with a low hemoglobin, and by definition that is what is called anemia. So the first thing we do in clinical practice is look at the complete blood count. So when you see the hemoglobin, according to World Health Organization, for men, anything less than 13, and for women, anything less than 12 is considered anemia. So what are the differential diagnoses of anemia, meaning what are the different causes of anemia? So especially when we're talking about different causes of anemia, we first look at the size of the red cells. Based on the size of the red cells, we classify anemia. When you look at the blood count, the size of the red cell is listed there under MCV, which is called mean corpuscular volume. So a normal MCV is between 80 to 100. So when somebody has a low MCV and anemia, we call it a microcytic anemia. So any MCV less than 80 is microcytic anemia, and the potential causes for this include iron deficiency, thalassemia, anemia or chronic disease, sideroblastic anemia, copper deficiency, and zinc poisoning. And then there's a normal MCV anemia, which is where the MCV is between 80 to 100. So people have normal size cells, but then they have anemia. And the potential causes for this include acute blood loss, early stages of iron deficiency anemia, chronic disease, meaning somebody has a medical problems for a long time, such as diabetes or kidney problems, and liver disease. So these patients have anemia with normal size cells. In addition, chronic renal insufficiency, meaning people with kidney problems for a long time can have normocytic, normochromic anemia, means the size of the cells are normal. In addition, patients with bone marrow problems can lead to anemia. Other differential diagnoses for normal size cell anemia include endocrine dysfunction such as hypothyroidism, means underactive thyroid or underactive pituitary. So other class of anemias are high MCV anemias, meaning the size of the cells are bigger and these people have anemia, and typically the MCV is more than 100. Examples of high MCV anemias include ethanol, which is excess intake of alcohol, folic acid deficiency, B12 deficiency, myelodysplastic syndrome, which is a bone marrow condition, acute leukemia, reticulocytosis, meaning that somebody's lost a lot of blood and then they're forming new cells in the bone marrow. We call them reticulocytes. And when the reticulocyte count is really high, then they can have like a large size cells circulating in the smear. The other causes of high MCV anemia include drugs such as hydroxyurea, chemo drugs such as azacitidine, liver disease, for instance. And then typically the tests we order for anemia include a huge panel of tests, which include a blood count, blood smear, B12 levels, folic acid levels, testing for thyroid, testing for autoimmune disease, testing for hemolysis, testing for multiple myeloma, testing for hepatitis. So the whole range of tests we order to get to the diagnosis of anemia. And with this testing, we can find the reason for anemia. Then we consider a bone marrow biopsy. So in summary, anemia is a very common disease that we see in clinical practice, and then we differentiate anemia based on the size of the cells. Iron deficiency anemia, B12 and folic acid deficiency are some of the most common causes that we see in clinical practice. Sometimes people have kidney disease and they have anemia. That is also very common. Order a bunch of tests to get to the diagnosis, and then once we find the diagnosis, we treat the cause. We treat what is causing the anemia, and hopefully with those measures, anemia will get better. But sometimes, especially with bone marrow problems, then we have to do other interventions to tackle anemia, and we'll have a separate discussion about it at some point. Thank you for watching this.